Hello and welcome. I'm Marleen Wong, Senior Vice Dean at the USC Suzanne Dworak-Peck School of Social Work. In previous sessions, I've outlined and discussed the practice of psychological first aid for schools, listen, protect, connect, model, and teach, which I may reference as PFA, just to shorten the title. One of the questions that some of you have posed have to do with whether this model of PFA in schools could be used by adults helping other adults who work in the same school. For example, a teacher helping a teacher, or a school social worker helping faculty or staff. The answer is yes. When crises disrupt a school, it's not only unsettling for students, it also causes distress for the adults in the school, the administrators, faculty, and staff. Crises force us adults to find new ways to function and cope. They force us to confront who we are and what we care about. We can feel more than uncomfortable and unsettled after a crisis. Some of us may feel traumatized and afraid. We're being placed in a position in which we have to confront our own limitations and personal fears. The impact of school crisis was illustrated by the results of a national survey conducted by Education Week after the horrific shooting in Parkland, Florida. Over 30% of teachers across the country stated that the tragedy had so deeply affected them that they seriously questioned whether they could or should continue working in the field of education. Secondary traumatic stress is an occupational hazard that faculty and staff can experience, and it can be helped with the use of PFA. Psychological first aid, peer support can help colleagues recognize their thoughts, feelings, and reactions after a crisis, including what might we have to do differently to adapt and survive in our jobs and with our families. The same 5 steps of psychological first aid apply to PFA peer support, with one caveat that I want to emphasize: respect the confidentiality of what a colleague speaks with you about. When providing psychological first aid, they may not only speak about the crisis itself, but they also may share deeply personal information about how it has affected their relationships, previous problems at the school, problems with health, mental health, or finances. This extraordinary openness can occur because a crisis in the present has ripples to a crisis or crises in the past. One example we confront in everyday life is when a colleague speaks to you about the loss of a family member. Hearing about that loss may cause you to reflect on your own bereavement in the past and the many ways that it changed the elements in your life: relationships at home or work, daily routines, your health or mental health, important holidays, birthdays, and family rituals. In peer-to-peer support, the commitment to maintain confidentiality is absolutely essential. The only exceptions are when an individual is a danger to self, a danger to others, or gravely disabled to the extent that they cannot care for themselves in the activities of daily living. If a colleague confides that her husband has a gambling addiction or one of her children is in rehab, that is information that should be considered and kept confidential. When we provide psychological first aid in school to our peers, we want to follow the 5 steps. Listen patiently in an accepting and non-judgmental manner, and convey genuine compassion and empathy. Protect peers from re-traumatization by helping them recognize their unique and specific concerns and how those concerns, fears, and worries have affected them in their daily lives, their daily roles and responsibilities. Reconnect and re-engage them with the school community, especially with faculty and staff. Help them think of specific people and new ways related to the crisis that they can be supported. Keep communication open at all levels of the school and share resources available to all faculty and staff. Model calm behavior. You can be a role model for positive change. Move forward with calm resolve and courage. Encourage participation in normal daily routines of school and express hope for the future that together as colleagues, we can find new ways of coping and adapting. Finally, in step 5, which is teach, we want to share information about the normal human reactions to psychological trauma, how long the acute phase can last, and the school and our community resources available if acute symptoms do not lessen after 4 weeks. Adults are empowered by knowledge and new information. When applied to peers helping peers, the main goals of PFA for schools, listen, protect, connect, model, and teach, are to help fulfill the mission of education. For faculty and staff, we want, number 1, to remove the social and emotional barriers to teaching and working with students. Secondly, we want to keep faculty and staff actively engaged in their work by reducing fear, stress, and worry. And the third goal is to help faculty and staff find new ways of coping and adapting to a new normal as they carry out their responsibilities in the school. Thank you so much for your time and attention and for joining me.